Good evening, a very warm welcome to you. Thank you for joining us on Nationwide on the network service of the NTA. I'm Ruth Aguela. Let's begin with security matters. The Inspector General of Police, Mohammed Adamu, has made a passionate appeal to Nigerians to promptly report cases of rape and gender-based violence in the country as part of their contributions towards putting an end to the dreaded scourge. Now, this was while addressing newsmen after being summoned by President Muhammadu Buhari over the worrisome situation across the country. We'll bring you details of this report in the course of the bulletin. But let's look at other issues in response to the impact of COVID-19 on health, livelihoods, businesses and jobs. A memorandum of understanding to avert job loss, promote enterprises and decent job creation has been signed by representatives of the Nigeria Employers Consultative Association and the Organized Labour to boost productivity. Emmanuel Ayimiro reports.
Going by the International Labour Organization estimates in April this year, about 1.6 billion workers in informal sector and 195 million in formal economy globally will be at risk of having their livelihoods destroyed due to coronavirus pandemic. This necessitated the coming together of social partners towards developing a shared perspective at mitigating the impact of the pandemic.
We have therefore agreed to work together, having identified the various roles we have to play to ensure a sustainable post-19 economy and job security for the mutual benefit of all.
It is very necessary, and that's why we have come together to sign a peace agreement that even if people are going to lose their job, it's going to be on reasonable ground.
Labour, in appreciation of government's effort at containing the spread of coronavirus, wants issues of insecurity in parts of the country to be addressed so as not to be robbed of the gains already recorded in the past.
Given the need to boost productivity and economic growth, at this time, we will continue to work with NECA to put pressure on government to provide businesses with palliative, grants, and physical support initiatives, including downward review of taxes and interest rates, in order to give businesses the breathing space to maintain production.
Both employers and workers' representatives pledge to imbibe the principles of social dialogue in addressing issues of industrial relations to boost economic activities across the nation. Emmanuel Ayimiro, NTA News.
Let's talk technology. Minister of Science and Technology, Dr. Ogbonnaya Onu, has stressed the need for Nigeria to invest more in science and technology for development towards repositioning the country to a techno-economic era. He said the ministry has succeeded in eliminating duplication of research through improved collaboration among research institutes, universities, industries and governments. Now, this was on NTA's Good Morning Nigeria. Let's hear from Lydia Sampson.
Science and technology is directly or indirectly deployed in all sectors of the economy. This realization has prompted developed countries to deploy huge investments to science and technology. The Minister of Science and Technology, Dr. Ogbonnaya Onu, however, lamented that this is not the case in Nigeria, as most investors in Nigeria want a quick fix, and as a result, there is shortage of investors in research findings that can reposition agriculture, health, and other sectors.
No nation has ever become truly great without science, technology, and innovation. A nation can be wealthy, but not great. And in most cases, such nations lose such wealth. But once it is on the basis of science and technology, you will find that it's sustainable.
While reiterating that research must meet the needs of society, Ogbonnaya Onu said this must be private sector driven. He said to generate interest in science and technology by catching them young, talent hunts across the 774 local government areas to the state and national levels help identify the best for government scholarship. The Energy Commission says the level of development in renewables under the Buhari administration led to provision of solar plants in the country. Also, in deploying technology in the health sector, breakthroughs have been made in developments of herbal teas and medicines.
From 2015 to now, then we've installed over 300 solar-driven water boreholes in rural communities. And you know what it is if you are from a rural community where you drink water from the stream, to have clean water. We've also done a lot of solar street lights in rural communities, and it improved security, especially at this time where insecurity is a major thing.
We have a candidate product for management of cancer, both breast cancer and prostate cancer. We've concluded all the quality assurance, the safety and the stability of that particular product.
The guests are optimistic that with the commercialization of more research findings on the drawing board, as well as more awareness on the importance and significance of science and technology, Nigeria will be a technology hub. In Abuja, Lydia Samson, NTA News.
June 15 has been recognized by the United Nations General Assembly in its resolution of December 2011 in response to requests by the International Network for the Prevention of Elder Abuse. It's a day the whole world speak out on issues regarding the abuse of the elderly. Research by the Department of Economic and Social Affairs Department of the United Nations said elder abuse is identified as a problem, mostly in the developed countries, and is underreported. It added that health and social problems are usually the perspectives deserving attention of the global community, calling for an urgent attention to improve welfare of the elderly. And you agree with me that a very vital component of the society is a group of the elderly who have served the society in one capacity or the other. Well, joining me in the studio to discuss the plight of the elderly in the modern Nigerian society is Dr. M.M. Omokaro. She is the Chief Executive of the Dave Omokaro Foundation, which is for the care of the elderly. Thank you very much for joining us.
Thank you for having me.
I know today is your day because I know you're very passionate about the elderly persons, yes. But what could you term in terms of activities and physical action done to the elderly that you would term as an abuse on the elderly?
First, we should know that abuse is any act of cruelty or violence meted against the older person that causes distress or harm, and is also an act that could be repeated. It could be just a one-time act, and is always perpetrated by persons in relationship of trust. So the setting where you find elder abuse could be living arrangements, could be care and support system situation, it could be long-term care, palliative care situation, could also be even older persons wanting to enjoy their leisure, continuing engagement. And where you find vulnerability and dependency, it means that that older person doesn't have the power to change his or her circumstance. So where abuse occurs within the living arrangement, because 55% of older persons live with multiple family members, this older person doesn't have the ability, the capacity to move out because of chronic poverty or because of health situation.
Yes.
And so where you will see that kind of thing is where, for instance, long-term care, you have somebody with dementia that requires 24/7 care.
Yes.
And you find that the family members do not have a respite, and they have to give this care and exhaust their limited resources. At some point, there's what we call the burden of care.
But
and
Dr.
you see a situation where they start reacting violently, insulting verbally, and situations like that.
They say when you're getting old, you become senile.
Necessarily.
Yes, but Dr. Omokaro, loneliness is one of the major psychological problems that most elderly persons, face. And that's a problem. Yes. But how do you think that could be, addressed? Because most times family members need to go out to fend for the family.
That is why in developed societies, even in most African societies now, you find where they have different kinds of interaction.
Sorry, I need to interrupt you there. Yeah. The daily briefing of the Presidential Task Force just got started. So we'll pause this. Let's join them.
Okay.
That's by 17th of this month, that's 17th of June, the task force would have operated for free months after inauguration. So let's go into the business of the day by inviting the chairman of the Presidential Task Force to please present his remarks before the Minister of Health, the DGN, CDC, and the National Coordinator come to the podium for their technical updates. The chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, I welcome you all to the national briefing of Monday, 15th June 2020. Let me once again use this opportunity to welcome you back from the 2020 Democracy Day holiday, which we all had to celebrate in a COVID-19 pandemic era. You will all recall that Mr. President in his broadcast on Friday, 12 June 2020, admonished all Nigerians, and I quote, "Notwithstanding our aspirations, humanity and indeed democracy is under the threat of COVID-19. He added, I quote again, "Nigeria has survived many crises before and came out stronger. I am confident that by the grace of God, we shall overcome this one and emerge stronger and more forceful." Mr. President's concerns about the impact of COVID-19 is underscored by the fact that 15 paragraphs of his broadcast were dedicated to COVID-19 issues. This buttresses the fact that the virus is still very deadly and everyone must take cautious effort to stop the spread by adhering to the guidelines and measures prescribed by the Presidential Task Force. In the course of our monitoring and surveillance of compliance across the nation, we have observed an escalation of the level of non-compliance with simple measures to keep social distancing, wearing of masks in public places, sanitation and hygiene. This is more prevalent in markets, motor parks, and some places of worship. I wish to remind you that the Presidential Task Force has already issued guidelines for mode of operations, places of worship, in markets, and other related public openings, and we urge state governments to ensure strict compliance with the PTF guidelines. We wish to re-emphasize that all relaxed measures are still subject to review, and advisories issued are for personal and public safety purposes. The breach of the ban on interstate travels is also a point of concern. Over the last couple of days, you have that the daily figures of the confirmed cases have been on the rise. This is an indication that we are conducting more tests across the country and that we are fully in the community spread phase. We, however, urge Nigerians not to panic, but to cooperate with the public health officials, especially where community testing is ongoing. Since the beginning of our multi-sectoral national response, we have described medical personnel as our frontline workers. We also continuously pleaded with Nigerians to take responsibility. The reality of today is that the table has turned and the community spread phase has suddenly made the health workers our last line of defense. The full import of this situation is underscored by the following quotes from Dr. B. Kalin Nawaga. I had cause to receive this from somebody yesterday who sent it on my WhatsApp. And this is the quotation from Dr. B. Kalin Nawaga. It says, I quote, "The war has shifted to the community, and it is up to you. This cannot be won in the confines of the hospital. We, the healthcare workers, are not your frontliners any longer. We are your last line of defense. You, my fellow people, are the frontline workers now." Ladies and gentlemen, let this sink. You are responsible for protecting yourself, your family, the community, and the country. Gatherings are not okay of any form. We must avoid it, either driving shows, rallies, whatever category. Be responsible. Lifted restrictions does not mean carelessness and that life is back to normal. Yes, there is a normal, but it's a new normal. The PTF appeals to state governments to embark on wider community testing, enforce rules on social distancing, step up community engagement and risk communication, and pay attention to places of large gatherings. We also appeal to the security agencies to enforce the ban on interstate travels very strictly. We have received reports that some states are contemplating the opening of schools, television viewing centers, sports stadium, and other places where large gatherings could take place. The Presidential Task Force re-emphasizes that it is not yet safe to do so, and that utmost caution should be exercised in this regard. The PTF guideline should be complied with while considering decision of this in the future. In line with revised protocols, the evacuation of Nigerians stranded abroad has resumed. Over the last weekend, we received 269 from India, while another 102 arrived from Egypt. All the evacuees tested negative before boarding the plane from their destinations and will be retested in Nigeria. Last week, the Economic Sustainability Committee, led by His Excellency the Vice President, submitted their report to Mr. President on how to address the post-COVID era. This underscores the plan that the federal government will continue to implement measures meant to safeguard the economy. The Presidential Task Force will continue to be guided by the recommendations of the committee in taking some of its far-reaching decisions, as we have done on previous occasions. A lot has been published regarding the studies carried out on asymptomatic individuals and their contacts, to how many develop COVID-19, and the finding that such transmission was very rare. While we note the clarification of the World Health Organization that the interpretation raised a number of questions on the implications of current preventive recommendations, the PTF shares the World Health Organization's position that comprehensive studies on transmission from asymptomatic people are difficult to conduct, but are needed to draw wider conclusions. Some modeling have tried to establish the proportion of asymptomatic patients that may transmit, and there is a big range depending on the models used. But some estimates are that 40% of transmission may be due to asymptomatic cases. The Presidential Task Force shall remain conscious and shall adhere to already recommended measures, particularly physical distancing, wearing of masks, coverings in public places, hand hygiene, and cough etiquette, until we have more evidence to propose otherwise. I now call on the Honorable Minister of Health, followed by the DG of the Nigeria Center for Disease Control and the National Coordinator, and thereafter our ministers, to give you updates on new issues. I thank you for listening.
Good afternoon. The Secretary to the Government of the Federation and Chair of PTF, Honorable Ministers, Permanent Secretaries, Directors, General Directors, ladies and gentlemen of the press. Yesterday, 403 new COVID-19 cases were confirmed and added to the number we have to increase the total to 16,085 that have been registered in Nigeria. We have treated and discharged 5,220 persons and sadly lost 420 to COVID-19. The case fatality rate remains at about 3%, which is lower than many countries, but not a cause for relief. The increasing pace of testing will yield more cases, but we need to also be proactive in keeping fatalities low, and this is not impossible. It is still strongly advised that those who test positive present themselves at a treatment center, and this is most especially so for those with underlying ailments like diabetes, hypertension, cancer, HIV, tuberculosis, or those who are 60 years old or above. These are the vulnerable population and form the majority of fatalities of COVID-19. The reason for giving special attention to this category of people is that COVID-19 symptoms can start very mildly with slight fever, slight cough, loss of sense of smell or taste, but suddenly escalate within days or hours to shortness of breath in no time at all. In conversation with Lagos State authorities has reported that people who delay going to hospital and begin treating themselves at home are at risk, and they are the majority of the victims. And those who have had underlying ailments and delay are the ones who barely can make it to the doorstep of the hospital. Early registration for treatment for vulnerable population will save more lives. Our response in tracing, testing, and case management is driven by data and evidence. I will continue to adjust our protocols for quarantine and treatment accordingly. We are collaborating with states to strengthen the response according to needs. An arrangement has been reached to to send such a collaborative team to Cross River State in the next few days to complement the work of the state government there. Apart from fighting COVID-19, the state government is also engaged in border patrol work because of the border they share with Cameroon and the unrest on that side of the border. The team to Cross River will be led by the Executive Director of National Primary Healthcare Development Agency, Dr. Faisal, and will engage in a technical handshake with the State Emergency Operating Center. Representatives from all departments and agencies, including NCDC, will be invited to go along, and also the Department of Family Health, Hospital Services, and epidemiologists. And because of the fact that they have a port health services will be included. Efforts are ongoing to increase the number of laboratories, and with priority given to states which presently do not have a laboratory with PCR capability, and these will include Cross River and Kogi states. We plan to be able to engage Kogi State in a similar manner within the next few days. We commemorated World Blood Donor Day yesterday, Sunday, and the theme of which was Safe Blood Saves Lives. That occasion was a clear reminder that despite COVID-19, other diseases and other problems still remain within our health system. We must not forget those ones. I interacted with Nigerians on social media platforms on the importance of blood as a critical and indispensable healthcare requirement for life-saving in maternal and child care, especially bleeding after delivery, severe anemia, sickle cell anemia, and in saving lives of victims of accidents. All of these are still going on as we talk. The advent of COVID-19 has affected the collection of blood and processing of blood because donors are not coming out as they used to. I had the honor of meeting with Mr. Akpan Nathan, a voluntary donor who holds the record of having donated blood 63 times. I salute him for his contribution. COVID-19 will be with us for a long time, and we shall keep learning as we go along. As part of that, the Ministry of Health is just putting finishing touches to a health sector response action plan to cover the next 3 years, divided into near, medium, and long term. It will be, of course, subject to modification as we learn more about COVID-19, but we provide guidelines for the health sector on how to prepare and rearm itself. It's a work that has contributors from some of the most learned experts in this country. Before I take my seat, I wish to advise again that we all adhere to the advisories on hand washing regularly or the use of alcohol-based sanitizers, to maintain physical distancing, and to use a face mask at all times when outside the homes. I shall be showing a small clip that came from outside the country that demonstrates of wearing a mask, as simple as it is in protecting oneself. The mask is not the only protection you can have. it is recommended to be something you use along with other measures. And I shall urge you all to look at this one carefully and learn some lessons from it. Thank you very much.
We have an important message for all of you, especially if you live in a country that is right now facing the new coronavirus. The pandemic is growing exponentially in many countries, but the Czech Republic is one of the few in Europe that has significantly slowed down the spread of the virus. In this video, we would like to tell you what we did differently, and mainly, we would like to help you to do the same. We are following social distancing and the rules stay at home. But others do that too. We also have strict hygienic procedures. Others do that as well. But the main difference is everyone who has to leave their house has to wear a face mask. Everyone. I know, they maybe told you that masks wouldn't protect you, but there are studies proving that even a homemade mask can be partially protective. Partially. Any protection is essential today. But now the more important thing. Masks fundamentally prevent the transmission from you to others by sneezing, coughing, but also breathing. And many people are the most contagious before they start showing symptoms. So, when we both have a face mask, I protect you, you protect me, and we are both safe.
Based on recent data, we know that population-wide use of masks is essential for suppression of the outbreak.
According to our professional experience, a simple homemade mask can prevent up to 100% of the spread of potentially infected microdroplets.
The more people use masks, the less virus can be distributed and fewer individuals are exposed.
Just a few days ago, people were laughing at those who wore masks. But some people knew about this positive effect and started to share this information across social media. The message grew fast through artists, influencers, and others. I know, face masks aren't in stores, right? But something incredible happened. People started making homemade masks and giving them to others for free. Many companies, theaters, or even retirement houses changed their buildings into sewing rooms, and thousands of people started to sew masks at home. So we know that face masks work, and it has been repeatedly confirmed by scientists. We know that it is possible in just 3 days to provide face masks for 10 million people in one country. And we know that here we have fundamentally repressed the infection. Please share this knowledge and help us to change as many countries as possible. Take a picture with your face mask on and share it with the hashtag Masks for All. It can really save lives. And remember, I protect you, you protect me.
They're going to be coming out with regulations on that, and if people want to abide by them, frankly, I don't think they'll be mandatory because some people don't want to do that. But if people want it, as an example on the masks, if people wanted to wear them, they can. If people wanted to use scarves, which they have, many people have them, they can. In many cases, the scarf is better. It's thicker. I mean, you can, depending on the material, it's thicker. A recommendation's coming out. We'll see what that recommendation is. But I will say this: they can pretty much decide for themselves right now.
Secretary to the Government of the Federation and Chairman of the Presidential Task Force, Honorable Ministers, colleagues, gentlemen of the press. Today, I will follow on the same theme because it's very important. Understandably, we are all craving for a return to some sense of normalcy. And in the past weeks, people have become very anxious about this and have really challenged all the norms that we have tried to introduce across the country. Everywhere around us, we see an increase in high-risk behaviors that is inevitably leading to more transmission. We're seeing cases increase. We're seeing deaths increase. Yes, we know it's hard to completely prevent exposure, but we have to do that which is possible for us to do. Just like we've seen from that video, there are many important lessons to learn from other countries. But there are also many lessons to learn from countries. If any of you has watched events out of Brazil in the last few days, and you're Nigerian, you'll be worried because we have a lot in common with Brazil. And yet, they have the second highest death toll in the world right now. If you're also interested in learning what is happening in India, another country that has a lot in common with us, they have the fourth highest number of confirmed cases in the world. We're seeing an increased number of cases, and we really have to think about this in very clear and unambiguous terms. It's not just in Lagos. Yes, our highest number of new cases is still in Lagos, but we're seeing increasing cases in many states across the country. And yes, we have eased the lockdown, not because we wanted to, but because we had to, in order to sustain livelihoods. And the chair of the PTF has referred to this severally. But we simply have to take more responsibility around the three interventions that are in our hands, around mass gatherings, and hand washing. I call them the MMW. Many people call them different things, but it's extremely important that we do more of this. And yes, that a church or a mosque decides to open doesn't make it compulsory for you to attend. Attendance is still a personal choice. That the supermarket in Abuja decides to do a concert doesn't make it compulsory for people to attend. The attendees are making a personal choice. Yes, there will be circumstances where it will be difficult to make those choices, but at least in things around leisure, those are the things that we have to make some personal sacrifice around. And even when airlines open and when travel open, we all have to think very hard. How important is that trip to us? How important is it? And this will be hard choices. The hardest choice is probably that of my brother, the Honorable Minister of State for Education, because we all know how important education is for our children. But we have to do the ones that we can do. And that's really why today you'll see from the chair of the Presidential Task Force, from the Honorable Minister of Health, and from the few comments I'm sharing, we really have to push harder on the things that are in our hands, those things that we can do. If you doubt that they work, you can look at the evidence around it. We must just do it more, do it together, and do it consistently. And yes, behavior change is hard. Many of us lived in Nigeria when the wearing of seatbelts, the not wearing of seatbelts was the norm. But now everybody goes into a car and puts on a seatbelt. It was a new norm a few years ago that became the norm. So we may not get there with face masks forever, but we do have to do this for the next few months. So we have to make it socially unacceptable to be seen outside the home without your face mask. And we have to hold each other accountable for this. We must push harder on each other to wash hands and surfaces regularly. And finally, we must discourage each other from mass gatherings that are not necessary. In the mass gathering that happened in Abuja that has been all over the social media, there were people there, Nigerians that looked at each other in the eye and said nothing, and celebrated each other for being there. Not a single person stood up and said, in the context of what is happening, for the sake of my parents at home, let's stop this concert. So yes, there will be a lot of discussion about the mall, about the regulations, about the flights, and you'll hear some of them. But for me, the most disturbing thing is the people that attended and said nothing and enjoyed that day with everyone else. So I'd like to end by just saying the health of each of us depends on the actions that each of us is going to take over the next few months. Thank you.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So first of all, I would like to just say that we had a very useful and productive meeting with members of the Public Accounts Committee today at the National Assembly.